introduce yourself.
Okay, so who wants to go first?
Hi.
You said you? Oh.
Hi, I'm Lori.
Hi, I'm Katie.
I'm Miranda.
Hi, I'm McKenna. I forgot to say my name.
Okay. So we are picking two objects that we have to say how they could help us solve a medical problem, right?
Yeah, healthcare
Yeah,
related
healthcare
issue.
problems. So my two items is I have a laptop, which is this, and a blanket. I'll just go ahead and say how my things would help. So laptops would be could be like used for charting things.
I think we have to like say when we're gonna start the presentation and do it all in 2 minutes.
Yeah, because we have to say what our problems are too.
Okay, we'll
We
start
haven't
over.
told our problems.
So
Well, I have paper and a calculator.
I have a pen and a pillow.
I have a phone and a scarf.
Okay. And our three problems that we've decided to talk about are nurse understaffing, language barriers, and communications with the interdisciplinary team.
Yeah.
Okay. So now, Miranda, I think you could go ahead and talk about, on those three things, what could your items help?
okay. My blanket could help with what was it? It was language, working together in a hospital with different
Staffing.
teams and understaffing. My computer could be used if we were understaffing and getting a hold of other staff members and seeing if we could get somebody to come in and help. The blanket could be used, well,
It could be
if
used
you're
to
understaffed, you might not. Go ahead.
I was going to say it could be used to comfort someone who doesn't speak English but would understand that you're trying to warm them or keep them comfortable
That's a good
by
one.
showing them that.
So are we just gonna talk about what we're gonna use our things for, and then we'll start a presentation and just talk about it? But right now we're just talking through it, right?
Right.
And then when we're all ready, we'll like say start or whatever and do 2 minutes of like a presentation.
Yes.
Okay.
I still don't get it, but yes.
So just make sure you like take notes that like your blanket will be used for like comfort or whatever. I mean, you know.
Yeah.
Yep. And the computer for understaffing. The computer also could be used for communication with the other teams like doctors and different, for orders and the different orders that we get from radiology or phlebotomy or any of those kinds of things.
And we could also use the computer to like help us like maybe understand some like keywords in their language too,
Yeah.
if they spoke a different language. All right, so I have a pen and a pillow, and I could use the pen to communicate to others in interprofessional communication. So I could chart, like I know that we do a lot of electronic charting now, but we can still do written charting. And then I could also use the pen to communicate, like maybe draw pictures for my patient who doesn't speak like our language, like maybe draw a picture of like his foot if I was referring to his foot or anything like that. And I could also give this pen to my patient, like to let him draw something back to. Sorry, I was trying to figure out what I was trying to get at. And then for like understaffing and everything, we would probably actually just use the computer to like post ads or whatever, but I was going to say I could write ads with my pen. And then with my pillow, I would use it to comfort the patient. Kind of like the same thing as the blanket, but the pillow I would use for comfort for my patient. I would also use pillows
Stuck.
to, oh, I guess I don't really know where I was going with that. I was just going to say I could also use my pillow to like make a patient comfortable if he does have to spend a while talking to like maybe like a physical therapist or something, but they're not doing therapy yet or something like that.
Or even if like your patient has like sores or something and they, you know, to pad the bony prominences, like you can use a pillow. So that's a good idea.
Yeah, to help so he doesn't have to go to like a different, I don't know. I would communicate to others that when they are done like working with my patient, they need to replace the pillows.
For understaffing, you can also use your pen for when we do schedules. So, and we do them all. Well, we do them in pencil, but still, all the scheduling to keep track of what our staff is, and also what our acuity is on the floor.
Yeah, you could use the pen for so much.
Yeah.
You like we learned today. You could use that pen to even mark like where you have the NG tube put in. Or that wasn't today, it was like yesterday. You mark like NG tubes, or if you're like palpating around like the liver, like to draw like the borders. I mean, there's endless things you can do with the pen.
Yeah, even like labeling like date, time, initials, stuff like that.
Mm-hmm.
Okay,
So
mine. Oh, you want me to go next?
Yeah.
Okay. You do, or you want me to?
No, go ahead. No, no. Go
okay, I thought you said that you did. Okay, so I chose a scarf, my scarf, and my phone. And for the phone, for the language barrier, I mean, you may need to call in, like, which I don't know if a nurse would personally call in a, what's it called?
Interpreter.
Yeah, translator.
And yes, nurses do call in.
Okay, so just call in like a translator, or maybe like someone in their family can speak English or some English, and maybe they need to like come in and help communicate, or if they need to like use your phone to call someone too. Like I feel like that's a good idea. And then for my scarf, I don't really. Maybe comfort also, like if they're cold, like say they're, but this really should be on one of these things that we use. So, I don't know, I'm just going to say for comfort then. Like, say that they've been like in a trauma and they're cold and that's the only thing that they have. So they're probably going to use my scarf like to cover them as much as they can.
Okay, and then you talked about the phone.
Yeah.
With understaffing, you could call the calling free for the staffing. You can call the staffing office to try to get another nurse.
Okay.
You call your supervisor to tell them that you're understaffed.
You could call anybody.
You would have. Those are the three things a charge nurse will call first thing.
Okay.
Okay. My things are a calculator and pen, paper. So, I guess with a calculator, you could calculate how many nurses you have.
Or doses. Say like the computer's down and you can calculate like a dose.
Yep. You can calculate how many patients you have on the floor.
Sorry, guys. I don't know if you guys can hear my sister's trying to call me.
Yeah, that's okay. It stinks if you have a Mac because it's like through your computer.
I know, it's so annoying.
And then paper for writing down all the things we just talked about. We can use it for communication between the different teams. We can use it for to draw pictures on and for language barriers.
I'm sure that they do like paper orders still sometimes, maybe, don't they? I mean, like that's probably not as.
Computers go down. You do.
Yeah.
My pen's freaking falling off, and it's making me mad.
Also, discharge instructions, prescriptions,
Mhm.
they're all still on paper.
Yeah.
I mean, they're printed off, but they're on paper.
Yeah. Okay. So now what? So now are we doing a 2-minute presentation then, or?
Yeah.
Yep. So who wants to go? And should we just each try to talk for 30 seconds? So just say like 1 or 2 good things.
Yeah.
Wait,
So,
we just say what we used our things for, right?
Yeah, but we have to get all 4 of us have to talk within 2 minutes.
okay.
Yeah, so just talk really fast. And we'll just like start with like Lori, then McKenna, then like just go down, go down the line.
Yeah.
So then,
Okay, so we'll just stick to talking about our own items, right?
Yeah.
Yeah.
Okay.
I have a timer pulled up too, so I can like say like next if you guys want.
yeah, that's great.
Should we say like, all right, we're going to start, here are our 3 problems, and then go?
Mhm.
Okay.
Just tell me when you guys are ready. So what's the order? McKenna, Lori, then I can go, and then Katie, do you want to go?
Yeah, I'll go last.
Okay.
Okay, sounds good. All right, so
It's okay.
we're going to start in just a second. So should we say our 3 problems before we start? Or after we start?
Yeah. No.
I think before and then, because there's no way we can say it all in 2 minutes.
Yeah, okay, sounds good. So our 3 problems are communication between the profession, communication with anybody in the health field, and then our second problem is language, and our third problem is understaffing. These are all in the healthcare field. Okay, so someone say go.
All right. Ready?
Yep.
Set. Go.
All right, so we're talking now about how we can solve these problems with our objects. So first I have a pen, and I could use a pen to communicate with others. I could use a pen to chart to others. I could use a pen to draw pictures to communicate with my patient who is not of the same language, and I could also let them communicate to me with the pen. And I could also use the pen for understaffing and underscheduling issues. I could use the pillow to make my patient comfortable, to help reduce injuries
Okay,
to my patient, and that's it. I would use my pillow for that.
Okay. Next.
Okay, so I would go ahead and use the calculator. I have a calculator and paper, and I would use calculator to figure out my ratios of patients to nurses for understaffing. I would also use the paper for scheduling, and the paper to help with the language barrier, to draw pictures with, and try to communicate with someone who doesn't speak English. Also with communication to other teams, if the computer systems were down, we could use paper for orders and prescriptions, and we could use the calculator for dosing medications if we needed to.
Okay. Well, me and Katie only have 30 seconds left, so I have a blanket which I could provide comfort with to the patient that doesn't speak English. It would be something that shows that I care. I have a computer for communicating with other staff members, like getting an X-ray order, look up things about a culture if I don't understand that, like for language. But yeah, those are my things.
I have a phone and a scarf, and I would use my phone to call in a translator for the language barrier, call staff for being understaffed, and call a supervisor. And I have a scarf that I would use for comfort.
Okay. So yeah, that was our 2 minutes.
That
Fastest 2 minutes I've ever experienced.
was so fast. I was like trying to go so fast. I'm sorry. I started off on a bad pace.
That's okay. Okay, so
Well, we got through.
Yay! Okay, so now once the team is completed, every team members, oh, we already did that. As a team, spend some time discussing your individual reactions and experiences. What thoughts and feelings were stimulated by the experience? How well did each of you respond creatively and critical thinking way to the team activity challenge? And what ways did you sense positive or negative group synergy?
We have a great group. We really do.
yeah. I'd say like.
And we're confident. in presenting.
Same.
Yeah, I don't think that any of us are really shy or anything. But I was gonna say that one of the things from this is that it made me kind of think of like how I could use a simple object for so many things. Like, I guess you don't really realize that you use a pen for so many things, or use a computer or a computer or phone, because they're basically both can do the same stuff, but for so many things too. So I guess it just kind of made me like think about ways I can solve problems with a simple object.
I feel like it also made us like, it definitely made us critically think, which we talk about critically thinking all the time. So it kind of just shows us how we can like use our resources like for anything basically. I'm not exactly sure what were we supposed to feel like the 2 minute, like making it so short. Is that just supposed to, what were we supposed to get like from that? Like, you guys help me out.
I think it was like kind of like put pressure on us to quickly like say what we needed to say. And like, since not everyone took 30 seconds, like maybe that was supposed to show that we were like still like didn't get upset with each other, even though that somebody wasn't like working quick enough or was working like too fast, or things kind of like that.
I think also just because, like, when you are in a medical emergency, like, you're going to have to be able to process and talk fast, like, to get through it. I mean, you're not going to be able to, like, just take your sweet time. So I feel like that might be part of it also.
Yeah, I think I definitely get the objects. Like, you can literally use stuff for so many things. Like,
and I think, like, sometimes you think, like, oh, a phone is used, like, for your own personal, or like even a scarf, but really there's more than like what you just think you can use it for, you know?
Yeah.
I think now that like we're talking about this, I'm still thinking of more and more things we could have used our objects for, like to help our patients.
Yeah.
The other thing is that it made us have to think really quick, come up with ideas in a very short amount of time. And it just made me think of the other day when I had a patient who I had a MET call, and so I commanded that whole, like a emergency, a medical, medical emergency. It's like a code, but not. They're still breathing.
Yeah, they call out over the intercom, don't they?
Well, no, they don't. They only call the codes over the intercom, but you call a special number, and then like a team comes, but. I remember walking out of the room after it was all done, because I had nursing students in there, and I'm thinking that, oh my God, I was so bossy when I was in there, but that's just the way you have to be, because you have to, I needed suction right away, I needed oxygen right away. I mean, these students were standing there, and they'd hand me something, I'm like throwing it, no, give me this.
Wasn't your personality type a lion?
Oh yeah.
Oh yeah, I can tell.
But you know, when
without you being in charge and telling people what you needed, then things probably could have gotten like way worse.
And someone's life is on the line. Like, this isn't like T-ball, you know?
Yeah, exactly. And her daughter was sitting right there when it happened and really freaked her out. And so I was just, you get so like in a zone and you focus so much on and your brain's going like 100 miles an hour of critical thinking of, what's this patient doing? What do I need? What are my first things to do? And so, as a nurse, you're gonna always, this kind of exercise of having to think of things fast. It kind of ties in with that, because you gotta think fast and you gotta think on your feet, and you got all these people around you, so you have to use them. Because you can't do everything. You know, you got to be the one who's looking at the big picture and knowing what to do.
Mm-hmm.
I feel like
but I still felt bad that I was so bossy afterwards.
I'm sure they understood.
Or that I scared them.
For like us to understand that like when you can't take things like personally, like in like emergency situations or in like medical like problems, like with you being bossy in that situation, like I shouldn't like think it of anything bad. Like you have to be able to like understand that certain situations, like you can't be taking it personal.
Yeah, it's nothing personal at all. And so, and you're only thinking about that patient at that second. And but I remember being a nursing student and just like running into rooms that had problems because I wanted to be in the middle of it. So if you guys, when you get those opportunities, you run into them because it'll really teach you a lot. I'm sure those girls learned a lot, even if they were a little scared at that point.
Yeah.
But it's kind of fun too, though.
Okay. So
we have to talk about how our team's confidence, problem solving, and presentation skills developed in and through this experience. Well,
well, we use our critical thinking.
Use critical thinking. We used each other, like when we were preparing for the presentation, we used like each other to like think of things. Like we weren't afraid to like ask each other like or use each other's like ideas about what our objects could be used for. Like I think that's one of the biggest things too about nursing is like being able to like take other people's advice and being able to
know that you're not the smartest person there. Like
that's like one of my worst pet peeves is like people like in my nursing class, like we're all at the same level, like and they try to act smarter than like some of our instructors.
That's literally my life.
20 years. It's like, guys, like just be humble. Like you're learning and they know what they're talking about and stuff. They're like, you're wrong. I work as a CNA and you're wrong. You know?
Yeah, I'm literally like half the time I'm like, why are you guys even in nursing school? Like,
because you already know everything.
Yeah.
It drives me crazy. It's like, aren't you here to learn, not tell?
Yeah.
So I think like you need to even be able to learn once you're a nurse too. Like learn from the older nurses, learn from the nurse who's had more experience in this area.
Yeah.
You will learn your whole entire career. And I just like totally like jumped on a nurse the other day for not asking for help. Because I will ask anybody. If I don't know something or if I want to run something by somebody, I do it all the time.
Absolutely.
Because how do you learn? And I don't know everything. And so it's the benefit of the patient to do that.
And I think that you just set an environment where you know that you have each other's back, like for the patient, you know.
Yeah.
So I think that that's an awesome environment to have because I know sometimes. Like, you may be there for 20 years, and a new nurse may have a better way to do things. Like, and I think that that's one thing that we have to know. Like, we have to be able to, like, take advice, even if we're, like, the more experienced one there, you know?
Yeah. You have to rely on them. It's not about you. It's about the patients and the patients you're taking care of.
Yeah, patient. Some people get too caught up in, like, their own self-pride that they won't ask for help, like, for me, like, I want people to, like, give me their feedback and help me out. It's going to help, like, steam my critical thinking, too, like, help it get going, especially being a new nursing student. It's nice to, like, have other people's ideas. It just makes you think of so many more.
Yeah.
I, like, am a person that, like, I'm always, like, asking, like, are you sure I'm doing this right? Like, you know, I would never be, like, someone that would be like, oh, like, you're doing it wrong.
Yeah.
So.
But always be that nurse that's open to have it that other people will come and ask you too, because I have lots of people that will come and ask me because they know I'm not going to berate them or I'm not going to make them feel stupid or feel bad.
Yeah. Okay. So I'm wondering, what else do we need? What the heck? What's wrong with my computer? What else do we need to do for this?
Well, that was the last one, and then we just have a reflection, right?
Yep.
Okay.
Yep. We have our reflection, and then does someone either want, or I can do it too, it doesn't matter, but does one of us either want to text or call him and figure out what we're supposed to do? Is just one of us need to submit the Hangout?
That's what I think.
Yeah, it's just Miranda. You can just put it into the YouTube.
Yeah.
Thing and then send it. What else
My computer's broken. It's like frozen.
Oh,
Mine's
I'm
been
just
kind of
gonna say there was no echoing this time.
Yeah.
Yay!
That's good.
I didn't want to jinx it earlier, but
I know.
we're done.
Okay, what do you want me to ask him? Like how we come up with our group name?
Yeah. Like what was that he
Let me read
Yeah,
it.
how did we come up with our group name? And I wanted to look at something else that I wanted you to ask him, but my computer's frozen.
Okay, hold on. Let me look.
Should I stop this hangout or
Yeah.
should we keep going?
You can just stop the recording.
Okay, stop, right.